Have you ever wondered if your back pain could be connected to your liver? It's a question that comes up more than you might think, so let's clear it up properly. Fatty liver disease is surprisingly common in the UK, affecting up to 1 in 3 adults. And the number of women being diagnosed is rising, particularly after menopause. Yet many women have no idea they have it, because in the early stages, it often causes no symptoms at all. So what is fatty liver disease? How does it relate to back pain? And what should you know? Fatty liver disease, often called NAFLD or non-alcoholic fatty liver disease, happens when excess fat builds up inside liver cells. You might also hear the newer term MASLD used alongside it. It exists on a spectrum, from simple fat accumulation with no inflammation, through to a more advanced stage involving inflammation and liver damage. For women specifically, hormonal changes around menopause appear to increase the risk. Estrogen may offer some protective effect against fat building up in the liver, and as levels drop after menopause, that protection reduces. Conditions like polycystic ovary syndrome, or PCOS, can also raise the risk through insulin resistance, which is actually central to how fatty liver develops. Now, it's the big question: can fatty liver disease cause back pain? The honest answer is rarely. The liver itself has no pain receptors, so in most cases, even when fat is accumulating, you won't feel it. If the liver becomes significantly enlarged, some people do experience a dull ache in the upper right abdomen that can occasionally radiate through to the back. But this typically points to more advanced disease, not simple fatty liver. It's also worth knowing that gallbladder problems, like gallstones, can cause similar right-sided pain that radiates to the back. So it's important not to assume the liver is always the cause. And if you ever develop jaundice, a fever, or severe worsening pain, please seek urgent medical attention. For women who have both fatty liver disease and back pain, research suggests the back pain is more commonly linked to musculoskeletal causes, particularly those associated with obesity and a more sedentary lifestyle, rather than the liver condition itself. When fatty liver disease does cause symptoms, they tend to be subtle. Fatigue, a feeling of fullness or mild discomfort in the upper right abdomen, or mild digestive discomfort. But many women in the early stages have no symptoms at all. So when should you speak to your GP? 2. If you have risk factors, such as being postmenopausal, having PCOS, type 2 diabetes, high cholesterol, or carrying extra weight around the abdomen, it's worth raising fatty liver disease with your GP. Diagnosis typically involves blood tests to check liver enzymes, though it's important to know that liver blood tests can be normal in fatty liver, so normal results don't always rule it out. Imaging such as an ultrasound is also commonly used. If further assessment is needed, your GP may use simple non-invasive risk scores first, before arranging tests like FibroScan or the Enhanced Liver Fibrosis Test, known as the ELF test, in line with NICE guidance. These help assess the degree of any liver scarring, known as fibrosis. In terms of management, the evidence points clearly towards lifestyle changes as the cornerstone of treatment. A Mediterranean-style diet, rich in vegetables, whole grains, fish, and healthy fats, is well supported by research. Regular physical activity matters too, both for the liver and for metabolic health more broadly. Managing associated conditions like blood pressure, cholesterol, or blood sugar is also an important part of the picture. Your healthcare professional can guide you on what's right for your individual situation. To recap, fatty liver disease is common and increasingly so in women after menopause. It rarely causes back pain directly, though significant liver enlargement can occasionally produce discomfort that radiates to the back. And lifestyle changes, alongside management of related conditions, are at the heart of treatment. Please speak to your GP or a qualified healthcare professional for advice tailored to you. Nothing in this video is a substitute for personalised medical guidance. Have you been diagnosed with fatty liver disease, or are you navigating unexplained back pain? Drop your questions in the comments. I'd love to hear from you. And if you found this helpful, please give it a like and subscribe to the Bolt Pharmacy channel for more health content like this.